Health authorities in quite a number of countries, including South Korea, have lifted all border restrictions related to COVID-19. Travellers are no longer required to be vaccinated, nor tested, nor quarantined. So are we ushering in an endemic phase of COVID-19? What do our COVID-19 tallies tell us? And when will indoor mask requirements be lifted in South Korea? Welcome to Issues and Insiders for this Wednesday. The common consensus with regard to COVID-19 is that it is currently trending downward, but the possibility of an uptick remains this winter in the Northern Hemisphere, even as efforts continue to embrace an endemic phase of this pandemic. For more, I have Professor Raywat Lee from Seoul National University here in the studio. Professor Lee, welcome back.
Thank you for having me today.
I also have Professor Raywat Deonandan at the University of Ottawa live on the line. Professor Deonandan, it's a pleasure.
It's my pleasure, thank you.
Right, Professor Lee, let's begin with your thoughts on the lifting of all COVID-19 entry protocols into South Korea.
As you said, Sunny, the government finally scraped off the post-entry PCR testing requirement within 24 hours for all travelers coming into South Korea. The requirement had some benefits, such as detecting new cases and new variants brought into Korea as early as possible. But the system did not work as it was planned to do. For example, almost 60% of people, travelers, did not follow the policy strictly, and but there was practically no way to enforce that policy to all travelers. The system was sort of not working properly. And on top of that, the number of new cases confirmed among travelers coming into Korea has been stabilized for many weeks. So I think the government has made the right step at this moment. And actually, the requirement, the pre and post entry requirements, had some bad effects on the economy because air ticket price has soared, and foreigners were very hesitant to come to Korea. Collectively, all of those kind of things undermined the basis of economy in South Korea.
Right. And Professor Deonandan, Canada also starting this month has removed all border restrictions with regard to COVID-19. Could you tell us a bit more about this measure there in Canada?
Yeah, the rules here have been changing a fair amount over the past couple of years and have differed depending upon if you're arriving via air or via land. But as of October 1st, the rules have become simple and quite consistent. So there are four big rules that have changed. First is that there is no longer proof of vaccination required to enter Canada. Second is that no longer are we requiring a negative PCR test, much like South Korea is doing. And also we're not requiring people to be quarantined once they arrive for a number of days. That used to be the case. A big one that's a bit more controversial is we are no longer requiring the use of an app. There's something called the ArriveCan app that we used to have people use to declare your vaccination status and to manage your ongoing travel. You can still use it, but it's no longer required. So those are the big changes that have happened since October 1st.
Right, I see. And Professor Lee, back here on the local front, in-person visits to nursing homes and care centres are now being permitted as well. How does this particular reality look to affect our efforts to better protect our vulnerable groups?
For almost 3 years, only non-face-to-face visits were allowed. That was brutally inhumane, I should say. Because that policy left our beloved family members and friends in an isolated space where they needed most emotional support, but they couldn't. So the government finally made a decision to lift that kind of ban, and they started allowing face-to-face visits. But the policy did not come with any sort of preventive measures. By that I mean all of the visits have to be pre-arranged, and all of the visitors have to show that they were test negative, and also they have to wear face masks during the visit. So again, I think the government has made the right step at the right moment, and I think this will give our beloved family members and friends a very nicer environment where we can enjoy meeting with each other again.
Right, of course. Meanwhile, Professor Deonandan, what can you share with us about the daily COVID-19 tallies there in Canada as Canada seeks to accept a new normal amid COVID-19?
We're coming off of a small wave this summer, and that wave peaked at about 5,000 known cases per day. And we're looking right now at about 2,500 known cases per day. And I say known because we don't test as much as we used to. Most of the testing that people do is the rapid tests, but those aren't reported to public health, and PCR testing is not widely available here. So I'd suggest that the number of actual cases is about 40 times that which I just reported. We do know what the deaths are, though, and the deaths seem to have plateaued at about 30 to 40 per day. Each one is quite tragic. There are two competing forces, though, that will dictate what happens next. First is that we have these new bivalent vaccines, which target the original strain of this disease and also the Omicron variant. And we have cold weather starting. And with the cold weather, people will go indoors, there'll be more transmission, and we have fewer restrictions now from public health. So those competing forces makes it difficult to know what's going to happen next. But I personally think we should expect cases to rise in the next few weeks and months, possibly looking at a new wave.
Right, I see. Professor Lee, staying with COVID-19 tallies here in the country, though, our critical cases now hover on the 300 level, and we have dozens of lives lost on a daily basis, unfortunately. What do these numbers tell us about the status of our COVID-19 situation?
It looks like we're in the process of getting out of woods from the recent resurgence after hitting the peak in late August. All of the statistics, such as the number of new cases, deaths, hospitalized patients, and critically ill patients, have been showing the pandemic has slowed down for several weeks. Not only that, the case fatality rate has been also maintained very low, under 0.1% since early this year. Of course, I'm not saying that the pandemic has ended, and we have to be very ready for another resurgence coming. That may come later with the introduction of new variants. However, the future certainly looks better and rosier than ever.
All right, we'll keep our fingers crossed, of course. Professor Deonandan, what can you tell us about mask requirements there in Canada?
So the mask requirements have been largely lifted recently. Certainly they're not required anymore on planes and trains and places like that. Private businesses can still require them if they choose. At least 14 universities here still require masks in classes and all indoor spaces. I was just at a banquet at one of those universities quite recently, a couple of weeks ago, and I was the only person wearing a mask. So it does vary a fair amount. Now that it's voluntary, depending upon which venue you go to, you either see a lot of people wearing masks or nobody wearing masks. So every day that passes, fewer and fewer people are wearing masks here.
What about mask requirements on public transportation? Are they still required there or not?
They are not required for the most part. Each city makes its own rules, but most are saying it's not required.
Right, I see. Professor Lee, there have been calls here in the country for a lifting of indoor mask mandates, especially following the recent rollback of outdoor mask requirements.
Right.
What are your thoughts on this?
Well, I think that they have a lot of points there. Actually, that's the only thing that I'm quite am happy with the current pandemic kind of policy by the government. The government has been very strong in keeping the indoor mask policy. It may be because there is no tool left with them to fight against COVID-19, or they may be so concerned about another resurgence after lifting the indoor mask mandate, which I think is a political sort of big burden for them. However, I don't think indoor face mask is as effective anymore as it used to be, or the way that the government will be. So not only that, many of us haven't already vaccinated. And also we have many tools and arms to fight against COVID-19, such as vaccines, antibodies, and antiviral medications. Eliminating the end-of-face mask is particularly important to younger children. Masks prevent them from reading facial expressions of others, and this is a big problem because it will prevent them from building emotional bond with others. Not only that, also language development can be hindered by wearing continuously face masks indoors. Again, I urge the government to lift the ban as soon as possible, maybe in a phased manner.
What are your thoughts, Professor Lee, of perhaps lifting the face masks next spring, which is one of the timelines given by authorities here? Yeah,
I mean, the government has repeatedly said that they would lift the ban by early next year, but I think it can come much earlier than next spring.
Right, I see. Professor Deonandan, it has been said by health experts that there will be no end to COVID-19, perhaps a transition from the pandemic phase to an endemic one. Do you agree? And if so, what are your words of advice with regard to ensuring public health amid this persistent presence of COVID-19?
It's probably impossible to eradicate or make this disease extinct. It's probably possible to eliminate it from the borders of a given country, but that's very, very difficult. So that leaves the option of endemicity. And while it's true that this will likely be an endemic disease, that's not necessarily a good thing. We can be endemic at high levels or endemic at low levels. And I think we should aim to be endemic at very low levels of transmission. And right now, globally, we're probably approaching that. It looks like the reproduction number at the global level is hovering around 1, which is a sign of endemicity. So the goal is to get it to the point where it's present, but not affecting or dominating our lives. So my advice is we can live our lives, but it's still worthwhile to avoid becoming infected if you can. So get all the vaccines that you are eligible for, all the boosters as well. If you have symptoms, stay home. Don't go to work or school, and wear a mask. Masks are a cheap and effective and powerful tool to curtail this disease and other diseases. And I think there's a lot of optimism as well. New vaccines are coming around the corner, intranasal vaccines, pan-coronavirus vaccines, and new treatment options as well. So there's a lot of reason for hope.
Right, and very briefly speaking, Professor Lee, Professor Deonandan has mentioned the presence of vaccines, of course, bivalent vaccines as well. What are your thoughts with regard to these bivalent vaccines?
It will protect us from being, I don't think it protects us from being reinfected, but it will definitely help us to from getting getting more critical, in other words, severe symptoms and hospitalization. Those kind of things, events will be prevented by getting vaccinated with those bivalent vaccines. And actually, Pfizer and Moderna they have submitted an approval package to the FDA, and that vaccine contains both BA1 and BA4/5. So those kind of bivalent vaccines will be much more effective than the current bivalent vaccine, which contains the original COVID-19 plus an Omicron variant BA1.
Right. And staying with that, Professor Deonandan, what can you tell us about the public response to bivalent vaccines there in Canada?
The uptake has been poor, in my opinion. It's not been as great as the previous versions. There's a lot of misinformation and disinformation about vaccines' efficacy and safety, and as a result, the uptake has not been great. Having said that, for those who want it, they can't get it fast enough. We only have the BA1 tuned bivalent vaccine, while the Americans have the BA4 and BA5 tuned one. So we may get that latter one very, very soon. I hope so. It's probably more attuned to the circulating strains at the moment. But it's a priority for many people here to accept that vaccine once they are eligible. Many are not yet eligible for it. We look forward to when younger people can be eligible for it as well. Right now, it's just those 18 years and above.
Right, I see. All right, Professor Deonandan, thank you very much for your time and your thoughts. And Professor Lee here in the studio, thank you very much for your insights.
Thank you.